on Beyond the Image, I'm sitting down with Rachel, Chief Health Informatics Officer for Steinberg Diagnostic. Thank you for joining me, Rachel.
I'm going to be so excited.
So let's start with giving our viewers a little bit of your history and background and what brought you to SDMI.
Wow, what brought me to SDMI? Kind of a fun story. So probably about 10 years ago, I was working for the Health Information Exchange. So at that time, Steinberg was a partner. Actually, my very first radiology center I implemented on the Health Information Exchange. 10 years ago, I joined Team SDMI as the Health Systems Director at that time. And that was about 10 years ago. And I've just really kind of grown over the last 10 years.
And what has that journey looked like in the last 10 years at SDMI?
You know that roller coaster that you ride where it's like thrills and then you're like, oh my gosh, I think I'm gonna get sick. And then once again, you're extremely excited. There's been definitely more highs than lows, and I can't be any more grateful and any more blessed for where I am today at Team SDMI. And I love saying Team SDMI, by the way, like hashtag Team SDMI. I'm very, very proud to say that. And you know, in that journey, I was given multiple opportunities. And so probably about halfway within my journey, I was promoted to the Chief Health Informatics Officer. And that was a new position within the executive team and didn't see it coming, right? It was a super big surprise. And at that time is when I was provided the opportunity to oversee the call center, to oversee what we now know as the Physician Support Department, and also made the division of IT versus HIT.
Tell us about some of the projects that you have worked on in your tenure at SDMI.
Some of the ones that really stand out, I'll just kind of touch on some of my favorites. The very first one I remember is that one of my very first projects was trying to automate things to help the patient experience. When the patient calls, it's really important to make sure that they know how much their test is going to cost. Like, that's a big anxiety, right? It's one thing to be anxious about something that may or may not be wrong with you. That's what I always tell individuals. Like, nobody wants to call us, not because we're horrible, but you're calling to find out is something wrong with you. And so when they're calling, my very first project was to be able to give that patient the estimate as well. So real time, being able to say, yes, the insurance company, no problems with your authorization, you're eligible, and here's the cost to expect. That was my very first project, and to this day, it's very important when that patient calls to make sure we can give them all that information. I think probably another one of my favorite ones was online scheduling. That was very new to Steinberg Diagnostic. About 4 years ago, we implemented online scheduling, and now today, about 12 to 15% of all of our patients are scheduled online. And you know, we kind of have a digital front door type of patient today, right? And so we want to be able to say that if you are a patient that completely likes everything electronic, that's online scheduling for you. But if you still want to answer the phone, then I have agents within my call center, which leads me to my very last and very favorite project, which is what we call Emma. And so Emma is our AI bot. She's not perfect, right? We like to say she's kind of in her infancy. She may be in her like terrible 2s or 3s right now because she's definitely giving us a hard time. But with Emma, we kind of have evolved our entire call center. And we've been able to give patients the ability, again, if you want to do everything electronic, you can cancel with Emma. You can verify your details with Emma. She can send you a text message to go look up directions, or if we accept your insurance. Or again, if you're the patient that would like to talk to somebody, I still have agents that you can speak to as well. And so Emma has just kind of brought like my big dream of digital front door to today.
How have you seen patients' adoption of digital options over the last 10 years?
Patients have adopted digitally maybe because they've been forced to, right? And so during the pandemic, I think it really changed the environment of digital within the healthcare space. I mean, it really changed everywhere, right? But just speaking of what we have felt here at Steinberg is that I remember sitting in the call center right smack in the middle of the pandemic, right next to one of my call center agents, and I was triaging phone calls. And at that time we had the big monitor on the wall, and there was multiple patients waiting in the queue. And the reason why we survived during that pandemic and really kind of came out as a community partner is because we took the time to put triage operators and just speak to the patient during that time. I again remember she was looking at me and was like, Rachel, oh my gosh, there's so many. And I said, just take one call at a time. Just keep answering one call at a time. I'm here with you. The stories I could tell the individuals that I spoke to during that time. And so that is not necessarily digital, but what that showed us during that time is we have to make sure that we evolve to two patient types. One that is going to adopt digitally if they like it or not. And so how can we make that a smooth transition? And the growth there has been exponential. It has really grown more within the last few years of the pandemic than prior. And then we do, again, still have the second type of the patient that no matter if I make it as easy as possible, they're going to want to call and talk to someone.
How do you, or what kind of data are you looking at to help guide SDMI in making the decisions of we need to implement this type of technological solution?
We look at a wide range of data. We look at things that include, I like to kind of break it up into a couple different pillars. We have the physicians, right? So physicians are partners, and those partners are going to send us all of the orders. So without the physicians, we don't have orders. So we look at all of the amount of orders that come in, what's the faxes versus electronic orders that I get, what's the turnaround time from the type I get an order to when I can schedule. I then look at the patients, right? That's my other pillar. When do patients want to come in? Do they like to come in more in the morning time for an ultrasound, more in the evening time for an MRI? Do they like evenings versus morning time? And with that data, I have trend lines, I have graphs, and then my third pillar is how does my staff react to it, right? So our workflow, our process. How long does it take me to turn around an authorization when I submit it? How many staff members do I need based off of the authorizations I do have to submit? So when we look at data, it includes financial, it includes patients, it includes the growth patterns, it includes, I feel like my list of what I'm looking at is endless because there's not one data set that we make a decision on. It's a collective amount of data.
And is that data that's looked at just before you're trying to decide to implement some kind of new technological solution? Or is that data that is monitored consistently to make sure that SDMI is giving the patients the best experience possible?
Consistently. The reason why I say consistently is because if you're not looking at the data on a consistent basis, you're going to miss that possible big jump, that possible big spike, and then now you're reacting versus being proactive to that change.
How does SDMI take patient feedback and allow that to influence the decisions that are made?
My office is right next to the Chief Administrative Officer, and she is amazing. Whereas another individual that answers some patient feedback, and we like to say patient constructive criticism. And why do I bring that up is because she answers every single one of those constructive criticism. And with that, my office being right next to her is we have this ability to where she might, hey Rachel, do you know why Emma is saying this? Or hey Rachel, do you know why we may have made this decision at the front desk? And so when patients come in and give the feedback, we are able to evolve. We're able to change. We're able to say, that is like a very valid point. You know, we never thought about that, maybe we haven't watched that process in a while. And so being able to get that feedback from the patient actually guides our change. The patient is part of our movement, even if they're not even realizing they're doing that. So even though at difficult, it may be times to get that constructive criticism, we still value it, and it's still needed, especially within all of my projects, especially within the technology advancements. It's those areas, it's that patient that will help us change. I've done it so many times within Emma. If it wasn't for the patients, Emma wouldn't make it to like age 5, age 10, age, she may never become a teenager if we don't have the patient's input.
What is your biggest challenge in your position?
I think possibly my biggest challenge is not being able to meet everyone's needs. It's as much as we try to identify the 2 patient types or identify all of our colleagues' needs or all of our physicians' needs, it's very difficult to meet every single one of those needs. And I'm also an individual that likes to manage my department to excellence. And I always like to share, if you're a patient, do you want to be that 1% that wasn't able to get your test done today? Do you want to be that 5% that we had to reschedule you? And so I think that's the most difficult, is that I strive to always make everyone happy. I strive to be able to meet your needs, the needs of the patients, the needs of the insurance companies, and I would say that there's a lot of pressure put on healthcare technology. There's a lot of pressure put on call center, and that would be my struggle, is we have to move quickly and be able to meet all of those industry desires.
So very, very busy practice, very busy call center, a lot of pressure, as you mentioned. How do you manage your team and keep morale up?
Celebrate everything. I mean, truly, I can remember, for example, when I had a new team member join the Health Information Technology Department. And I would send emails out saying like, we can hit 700 total scheduled appointments today online. We can do that, right? And okay, whatever, Rachel, that's not a big deal, right? As soon as we hit 697, I said 3 away, we're almost there. From that day, she's watching that email. We're gonna hit 700, we're gonna hit 700, because we're gonna celebrate 700, right? Within the call center, if we celebrate birthdays, we celebrate holidays, a treasure chest. That's probably my most exciting right now, right? I don't want to, share too many secrets of SDMI. Not the patients, that our teammates feel that they are seen, right? That they are important, and so we celebrate every single little thing. I would also like to say, on a grander scheme, not even my department, we celebrate the 12 days of Christmas. We celebrate with smoothies. The coffee truck is amazing. And I think as an organization, we continue to say like, here's just a little thing because we notice you.
How do you manage work-life balance?
Sometimes I do it well. Other times I do not. So, I am a busy mom. And even though my kids are getting to, late teenage and early young adults, is my kids and my family are everything to me. And that's what I strive to make sure my team members feel the same way. I like to explain that we all have seasons, right? There's gonna be a season where I may need to step away for a little bit, but I know my teams are gonna have my back and they're gonna support me. Because guess what? They're gonna have a season as well. And so I think my most important ability to balance that is to know that it comes in seasons. And that if I build an ecosystem around me, that we're always going to support each other in our seasons, then I'm not gonna worry if I have this season to where, I can maybe take a little bit more time off than I would like to, because I'm going to support my other teammate that has their season. So that's the way I like to break it down. We all have our seasons.
SDMI's mission is to provide an exceptional patient experience, and that really starts with that first phone call that they make, which is coming into an operator or the call center or to Emma.
Yep.
How do you make sure that your staff keeps that mission as their focus?
You know, it's I'm not going to say it's like the easiest thing, right? I you know, there are times when we request to smile, right? But you may have just gotten some horrible news. And I'm gonna get emotional, because we actually have a call center employee that has had to leave us recently because of some healthcare concerns, right? And it doesn't look good right now. So I think what we strive to do is continually just hold each other up, right? And continually, I think it goes back to the earlier question you asked me, what is the hardest part of my job? I feel like if I could go to every single employee in the entire Steinberg, and not even within my call center, but let's focus on call center because that is the first phone call. If I could sit with each one of them and just instill it's okay to show empathy, and it's okay to be vulnerable, and it's okay to take as much time as you need with that patient, so they understood that that is the culture of our call center. And so that's what I strive to continue. I think that's an ongoing focus for me, is to just make sure that the call center feels every single day that they are important to that patient. That patient needs them when they call here.
What do you think sets SDMI apart from other healthcare practices?
Definitely, I would say our team. I think that the idea of doing this series right here is something that I'm excited and, again, blessed and grateful that our leadership team just believes in doing why this is important. I think that it's the people that make sure you're taken care of.
What do you think SDMI's biggest impact has been on the community?
We're such a community partner. We are involved in IT programs. We are involved in call center programs. We are involved in supporting children with cancer foundations. We are involved in immunizations. I mean, you would think that, oh, we're radiology and maybe we're involved with the community. And I think the biggest impact is that, one, we are privately owned, and we live in this community. And so I think when we say that the patient experience is our most important, it's because we're remembering our neighbor next door. We're remembering the individuals that, possibly filmed this series, and I'm gonna, run into them because they live in my community. Everything that we do, we strive because we remember it's the individual we're gonna pass by in the grocery store. It's, oh my gosh, the friend of the friend that just found out she has cancer. It's the friend of the friend that I've held hands with in the PET scan. Like, those are the individuals, and that's why we're different, right? I mean, we as Steinberg Diagnostic live and breathe this community, and that's what separates us from everybody else.
So you've talked about collaborating with the CAO and the CIO and some of the different departments. How much collaboration goes on from department to department within SDMI, and how specifically does that touch either HIT or call center from your perspective and your position?
Every department touches every department. It's cross-functional, right? And to be able to provide that exceptional patient experience, every department has to work collaboratively. I like to think of it as, are you part of our ecosystem? And our ecosystem means that the directors meet on a regular basis to discuss workflow. The executive team has a focused executive meeting to make sure that we go over all of the areas. The managers meet with the HIT team. The chief techs meet with the IT team. It just, the list continues to go on. And so we have regularly scheduled meetups, but then we do a lot of ad hoc meetings as well, right? If there is something that is emergent, all the individuals pull together real quickly. And we do have representatives from every single team. That also includes, our EVS and our maintenance teams, because they're important to the patient experience. Every individual, I'm trying to make sure that I touch on every single department, because every department is part of that. And so it's easy for me to speak on it, because there's not a day that goes by where I think that somebody is not touching one or two or three other departments in part of their regular day.
What do you think is the future of SDMI?
We at Steinberg Diagnostic are going to continue to evolve. We're going to continue to grow. We're going to continue to level up. We're going to continue to meet the needs of our community. So the future of SDMI are in the hands of the community.
What advice do you have for somebody who is looking to get into healthcare as a career?
I started in healthcare, and that's how I ended up in healthcare technology. And I absolutely love what I do. I love healthcare informatics. It's a true passion of mine. And the reason I love it is because I'm still part of the patient experience, but I don't touch the patient. I don't have to worry about being part of that. So I think that there's a lot of different avenues in healthcare, and I think an individual just needs to ask, what do you love about technology, right? So possibly there's a lot of reward in being part of a technology job in healthcare, because a server that goes down possibly doesn't impact certain companies like it would when a patient can't get their scan done, or can't get their labs done, or can't get the dialysis treatment that they needed to get done. It's so much more impactful when you're in the healthcare community, because you know that you're helping others. So there's such a wide range when you think of getting into healthcare. You could be patient facing, you could be bedside, and that is, you're a, true healthcare patient facing individual. But then you're still an essential individual in healthcare if you're behind the scenes, working on the patient portals, working on series such as this to make sure that you can inform the patients. And so healthcare is so broad. So I would say if there's any sliver of a desire to go into healthcare, move forward. Just keep going.
What about advice for patients? What advice would you give patients on how to navigate healthcare?
Be your own advocate. Number one, absolutely. I have the biggest range of patient, I feel like, within my own household, right? I have the teenagers to the midlife husband to the senior, elderly parents. And the reason why I say be your biggest advocate is because there's so many times when patients are waiting for something or somebody to tell them when to move forward. And so as a patient, I want you to call Steinberg and ask them any and every question that you have. I want you to create a patient portal sign-on and go access your results and your images. I want you to ask for the paperwork. I want you to ask every single question during your exam. And then I want you to go tell all of your friends how amazing Steinberg is, because they walked you every point of your journey.
So I have one final question that I like to end all of my conversations with, and that is, what would your younger self be most proud of you for or most surprised by?
I'm very proud that I have stayed true to myself and that I have continued to speak up when areas were important to me.
Awesome. Thank you so much for joining me today.
Appreciate it. Thank you.